of all, congratulations on the arrival of your new baby. Once you and your baby have been deemed clinically fit for discharge home, there will be a number of things your midwife will need to organise before you can leave. These can include preparing any medication you may need to take home with you, changing dressings you may have, checking that you're completely happy with how you're going to feed your baby. Your midwife will need to complete your discharge paperwork. We will also need to check your address, telephone number and GP details are correct to pass on to your community midwife. Once these things have been completed, you and your baby are ready for discharge home. This can happen at any point, day or night. However, we ask for your patience as we are a busy unit and like you, many women and their families are receiving care and attention. Before leaving, you will need to have your baby's security tag removed at the main desk. We ask that you do not carry your baby in your arms to the car, but take them off the ward in either a car seat or pram. I'm sure you are keen to go home and celebrate, so this discharge video has been created to provide you with the information you and your family will need over the coming weeks. So please sit back and enjoy, and your midwife will also be available to answer any questions you may have.
You will need to register your baby within 42 days of being born. You can register either in Swindon or at your local register office. Depending on your marital status when the baby is born, either both parents can register or just the mother. For full information on what is required to register the birth, check the Registering Your Baby's Birth leaflet issued to you on discharge. As well as legal birth registration, remember to register your baby at the GP surgery.
When going home after giving birth, there are a number of potential complications that you need to be aware of. It's normal to bleed vaginally for up to 6 weeks after giving birth. The bleeding will initially be quite heavy and red in colour, but over time it should get lighter in flow and then darker in colour. If your bleeding suddenly becomes red in colour again, or you start passing clots and saturating pads, phone the maternity unit for advice. After having a baby, there are a number of areas which are vulnerable to developing infection. You should report any fever or raised temperature, new onset abdominal pain, offensive smelling vaginal loss and general feelings of being unwell. If you've had a caesarean section, your community midwife will remove the dressings at around day 5. To care for your wound, you should shower daily and make sure that you clean the wound afterwards with a clean towel. It's also important to look at your wound every day, and you can use a mirror if needed. You should check for any areas of red or hot skin or any discharge at the wound site. Try and wear underwear and trousers that sit comfortably above the wound so as not to irritate it, and avoid heavy lifting for around 6 weeks after your caesarean. If you've had a perineal wound, again care for that by ensuring you shower every day, change maternity pads regularly and wash hands before and after using the toilet. You should report any new pain, vaginal loss or unusual smells to your community midwife. You can check your perineum at home. Some women can go on to develop a problem with blood pressure after giving birth, or occasionally a pre-existing blood pressure problem becomes worse in the 72 hours following birth. If you develop any persistent headache that won't go away with pain relief, visual disturbances such as flashing lights or floaters, nausea, vomiting or pain in your upper abdomen, inform the maternity unit so that we can arrange for somebody to check your blood pressure. All women who've been pregnant have an increased risk of developing blood clots in their legs and chest for up to 6 weeks following birth. You may have been given some compression stockings and some blood thinning injections to reduce your risk. If you've been given either, it's important to use them as directed, finishing the entire course of medication. If you notice any redness, pain or swelling in your calf, or any pain in your chest, shortness of breath or coughing up blood, you should contact the maternity unit immediately.
After delivery, take time to regain your posture, energy and return to pre-pregnancy fitness. Relaxation is important for recovery. Sleep while baby sleeps. Pelvic floor exercises are an important part of your recovery. They support your pelvic organs, stabilise your pelvic joints and lumbar spine. They are important for bladder and bowel control and sexual function and sensation. Start exercising your pelvic floor muscles as soon as possible, either sitting or lying on your side. If you have a catheter, wait until it is removed. Imagine stopping yourself from passing wind. Gently pulse and relax the muscles to aid healing. See how long you can squeeze your pelvic floor muscles for and fully relax. Aim to hold for a few seconds and build up. Repeat pelvic floor exercise every time you feed baby. Squeeze the pelvic floor before coughing or sneezing to prevent urine leakage. There are a number of postnatal exercises that can aid your recovery. Here are a few we suggest. Maintain circulation by moving your feet regularly while in bed. Think about your posture. Stand tall with your shoulders relaxed. You need your deepest abdominal muscles working with your pelvic floor. Inhale as your tummy rises and exhale while you contract your lower tummy. Do this for 2 to 3 breaths and then relax fully. Lie on your back on the bed or a mat, knees bent, feet flat. Gently contract your abdomen and flatten your back. This is called a pelvic tilt. Hold this for 3 seconds and repeat 10 times. In the same position, contract your abdomen and then roll your knees slowly from side to side and then back to center. Try to exercise gently. If anything hurts, stop, speak to your midwife or a health visitor. You can try brisk walks with pram handles at the correct height, increasing the time and pace over the 6 weeks. Take care with baby carriers as they can strain your neck or your back. Your pre-pregnancy fitness will impact your rate of recovery, and be wary of high-impact exercise. If you have pelvic girdle pain, loss of bladder or bowel or wind control, vaginal bulging, backache or separation of abdominal muscles, ask for a referral to a physiotherapist. And if you have had a 3rd or 4th degree tear, you will be reviewed by a physiotherapist at 6 weeks postnatal. If you've had a cesarean section, there are a number of things to consider. Roll in and out of bed and support your tummy. Support your wound with your hands or a cushion when you cough. And stand tall with your shoulders relaxed. For the first 2 weeks, potter around the home to increase fitness. Accept help with hoovering or carrying shopping. Your baby should be the heaviest load you lift for the first 6 weeks. Avoid bending over or straining your back when attending to baby. Before you return to driving, at 4 to 6 weeks, we recommend you check with your insurance company first. We suggest you increase your fitness and exercises gradually after 6 weeks. For further support, please refer to your Going Home from the Maternity Unit leaflet.
It is perfectly normal, following the birth of your baby, to suffer a period of mild depression called the blues, which could last from a few hours to a few days. Pregnancy and the period after childbirth are significant times of change in a woman's life. The blues may present itself in various ways. You may feel you cry for no particular reason, or feel increased anxiety and tension. You may also feel little pleasure in doing things that used to make you happy. It is very important, however, to identify when the blues has progressed into something more serious. Low mood, frequent crying, feeling overwhelmed and confused can be normal to an extent. However, if you feel you are not bonding with your baby and feeling withdrawn, these feelings can all be signs of developing postnatal depression. If these feelings persist for longer than a few days, please speak to your midwife or GP. The GP can provide information, advice, and treatment, and can refer you to psychological therapies or mental health services if needed. Before attending your appointment, try to note down how you're feeling and, if possible and appropriate, take along a partner, a friend, or a relative. You should not go on suffering depression alone in the hope that it will go away. A number of services and professionals offer help and support during pregnancy and after your birth. Examples of services in the local area are the Lift Psychology Wellbeing After Baby courses that are available in community, the Shine Swindon project, which is based in Old Town and supports mums with postnatal depression in Swindon. Shine offers 12-week courses of art therapy, yoga, hypnotherapy tasters, nutrition workshops, and much more. Additionally,
On the Great Western Hospital website, you will find useful information in the maternity services section with videos and experiences of other parents via the My Mental Health Matters link. There is help out there for you. You do not have to go through anything alone.
Once you've settled at home with your baby or babies, you may find you have some questions you would like to ask about your experience of labour and/or your birth. Our Birth Matters service can provide a warm and friendly environment, giving you the opportunity to talk through events, enabling clarification, filling in the gaps and answering your questions. You are very welcome to bring somebody to your appointment, and of course your new baby is very welcome too. The service is open to anybody who has previously given birth under the care of the Great Western Hospital, or who is pregnant and is planning to have their baby with us. There is no cut-off period, and you can contact us weeks, months, or even years after you've given birth. On discharge from hospital, you will receive a leaflet with some further information. To make an appointment, you will just need to give us a call. You may need to leave a message with details of your full name, your date of birth, and the first line of your address. We will then send you an appointment letter in the post. Never too soon to think about contraception. Planning and spacing pregnancies is an important part of your fertile years. There are a lot of different methods available and not one size fits all. We would welcome the opportunity to discuss your needs so you can find a method that is most suited, whether that be barrier method, oral contraception, or one of the long-acting reversible methods such as injection, implant, or intrauterine contraception. A further pregnancy can occur as early as 4 weeks post-delivery of your child. A lot of methods can be started before this date and are safe to use if breastfeeding. Information about our services and resources are available on our Swindon Sexual Health website.
You know your baby better than anyone. If you think that they're under the weather, it is best to seek medical advice. Your health professional will always make time to see a potentially unwell child. Although babies cannot tell you when they feel unwell, they can display signs and changes in their behaviour. When you go home, it is important that you monitor your newborn baby's nappy. That is a good indicator of hydration, but also an indicator of good health. It is important that your baby has had a wee and a poo by the time they're 24 hours old. If their skin turns a yellow colour, which is called jaundice, within 24 hours, you should contact your midwife or hospital urgently. If your baby starts to feel unwell, they may be less active or responsive than normal, or they may seem irritable. Their breathing may seem faster, or they may make a grunting noise when breathing. They may not be feeding as normal or producing as many wet nappies. Your baby's fontanelle, which is the soft spots on the head, could be depressed or bulging. If your baby's appearance changes, so if they're blue, floppy, or have a fit, or if they vomit green fluid, you should seek medical advice. Checking your baby's temperature is a good indicator of how they're feeling. You should seek medical advice if it's above 38 degrees Celsius, or they feel cold to touch when they're dressed appropriately for the environment. If you're worried about any of these things, you should contact your midwife, hospital, or GP for advice. If your baby stops breathing, won't wake up, or has a rash on their body that doesn't fade when you press a glass against it, you should call 999 for an ambulance.
Jaundice is caused by too much bilirubin in the blood, which is normally passed out of the body in urine and stool. Ensuring regular feeding will help your baby to do this. Most babies have jaundice, and for most it is harmless and nothing for you to worry about. However, you should always let your midwife or doctor know if you think your baby has jaundice. Jaundice can be noticed in the skin, whites of the eyes, and the gums or roof of the mouth can also appear yellow. Gently pressing on your baby's skin can also reveal a yellow tinge. A good opportunity to check your baby is when you are changing their nappy or clothes. Make sure you're checking in a bright area with lots of natural light. A jaundiced baby may also be very sleepy, difficult to wake for feeds, and may stop producing regular urine and stool. If you notice any of the signs mentioned, contact your on-call midwife or doctor. If this happens within the first 24 hours of birth, contact them urgently. If your baby is older than 24 hours old, contact them the same day. In order to diagnose jaundice, your midwife will measure the levels of bilirubin in the blood. This is done using a small handheld device that can read the levels in the blood without needing to puncture the skin. Alternatively, a small blood sample may need to be taken from the heel and potentially retested 6 to 12 hours later. Mild jaundice often doesn't require any treatment. If the level of bilirubin in the blood is high, your baby may need to receive further light therapy in hospital called phototherapy. They are placed under a lamp which emits a special type of light onto the skin, which aids the breakdown of bilirubin. If the bilirubin levels are extremely high, your baby may need to be treated in a special care baby unit. More information is provided in the jaundice information leaflet issued to you at discharge.
You will have received support with getting feeding off to a good start whilst you've been in hospital. Now that you are going home, there are some things we'd like to share with you. New babies want to be close to their parents. This helps them feel secure and loved. When babies feel secure, they release a hormone called oxytocin, which acts like a fertilizer for their growing brain. This helps them to be happy babies and more confident children and adults. Holding, smiling and talking to your baby is good for both of you, as it also releases oxytocin in you, which helps you to feel calm and happy. Keep your baby close to you so that you start to recognise the signals he makes to tell you he is hungry or wants a cuddle. He may suck his fingers or fist, open his mouth and move his head, open and move his eyes or start wriggling. Responding to these signals will make your baby feel safe and he is less likely to cry for a feed. Cuddling your baby next to your skin allows her to smell you and hear your heartbeat, which will comfort and calm her. This will also help you to feel calm and relaxed and will help with breastfeeding. Breastfed babies cannot be overfed, so you can breastfeed to soothe your baby as a way of spending time together or having a rest whenever you both want. If you are bottle feeding, hold your baby close during feeds and look into his eyes. Learn to notice his cues that he wants to be fed and when he has had enough. If you and your partner try and give most of the feed yourselves, this will help build a close and loving bond with your baby. Continuing skin-to-skin contact, however you are feeding your baby, can calm and comfort you both at any time. If you are breastfeeding your baby, there are lots of different positions you can try. Just check the following. Is your baby's head and body in a straight line? If not, your baby might not be able to swallow easily. Are you holding your baby close to you? Support her neck, shoulders and back. She should be able to tilt her head back easily and she shouldn't have to reach out to feed. Are you comfortable? It's worth getting comfortable before a feed, although it's okay to change your position slightly once your baby is attached to the breast. Is your baby's nose opposite your nipple? Your baby needs to get a big mouthful of breast from underneath the nipple. Placing your baby with his nose level to your nipple will allow him to reach up and attach to your breast well. Bring baby to you and resist the urge to move your nipple into your baby's mouth. Things to look for to know your baby is well attached to the breast. Your baby has a wide open mouth and a large mouthful of breast. Your baby's chin is firmly touching your breast. If you can see the dark skin around your nipple, you should see more dark skin above your baby's top lip than below your baby's bottom lip. Your baby's cheeks stay rounded during sucking, and it doesn't hurt you when your baby feeds, although the first few sucks may feel strong. So signs that breastfeeding is going well. Once baby is 24 hours old, your baby has 8 to 12 feeds in 24 hours. They may want to feed frequently at times with very short gaps in between feeds. This is called cluster feeding and can happen in the day but is very common during the night. Your baby's feeds last between 5 and 40 minutes. Your baby is generally calm and relaxed during feeds and content after most feeds. Your baby will have at least one wet nappy on the day she is born and day 1. This will increase to a minimum of 2 wet nappies on day 2, 3 wet nappies on day 3, 4 wet nappies on day 4, 5 wet nappies on day 5, and by day 6 and onwards, your baby should have at least 6 heavy wet nappies in 24 hours. At the beginning, your baby will pass a black tar-like stool, poo, called meconium. By day 3, this should be changing to a lighter, runnier, greenish stool that is easier to clean up. From day 4 and for the first few weeks, your baby should pass 2 or more yellow stools a day. Most babies pass lots of stools and this is a good sign. Remember, it's normal for breastfed babies to pass loose stools. From day 6, your baby should have at least 6 wet and 2 dirty nappies a day, and the amount of poo varies from baby to baby. Your nipples and breasts should be comfortable. Your baby rhythmically takes long sucks and swallows. You will be able to hear your baby swallow milk from around day 3 to 4, and it's normal for your baby to pause from time to time. Your baby finishes the feed and comes off the breast on his own. Your baby should be gaining weight after the first 2 weeks. If you're concerned about any of these points, speak to your midwife before you leave hospital. Or if you're at home, contact your community midwife or health visitor. Hand expressing can be a useful skill for mums to know. It can be used to increase your milk supply, to tempt your baby to feed, to relieve blocked ducts, and many other reasons. To express your milk by hand, have a clean, sterilised container to hand before you start. Gently massage your breast. Cup your breast and place your thumb and finger about 2 to 3 centimetres from the base of your nipple. Using your thumb and the rest of your finger in a C shape, gently squeeze this area, and this shouldn't hurt. Release the pressure and then repeat again and again, building up a rhythm. Avoid sliding your fingers over the skin. At first, only a few drops will appear, but just keep going as it will help build up your supply. With practice and a little more time, milk will flow freely. When the flow slows down, move your fingers round to try a different section of your breast and repeat. When this happens again, swap to the other breast. Keep changing breasts until the milk is dripping very slowly or stops altogether. If the milk doesn't flow, try moving your fingers slightly towards the nipple or further away. For expressing information, please refer to the Expressing Your Milk information guide. Once you're at home, you can contact your community midwife or health visitor for support with feeding. There are also parent-led support groups in and around Swindon. In Swindon, there is Breastmates and Mum to Mum in Wiltshire. Information about these groups can be found on the Great Western Hospital Parent Information page. For national support, phone the National Breastfeeding Helpline, the number for which is on the screen.
After you leave hospital with your baby, your care is continued by the community midwifery team. These visits are carried out by midwives and maternity support workers who complete important health checks on mums and babies and also offer support and advice with any concerns you have once you're home. Our first visit will be the day after you have returned home. We will come and see you between 9 and 5. Due to the unpredictable nature of our work, it is difficult to give a time of visit. So if you have other plans, then please call our bleep holder to advise us. Please also ensure that the ward midwives have the correct address and telephone numbers for you before you go home. At weekends, we run clinics at the hospital so that you can have a set time for your checkup, which parents find very useful, especially for your 3 to 5 day checks when you may be wanting to get out and about. All our hearing screening tests are completed there on day 5. We also run a similar system during the week with satellite clinics around the area. Mums whose babies are staying in special care will obviously want to spend as much time there as they can, and we contact those mothers to arrange to see them in hospital. If all is well with mum and baby's postnatal recovery, then we expect to discharge you to the care of the health visitor at around 10 to 14 days. We are responsible for you until 28 days, so if you are discharged but have any other concerns, you can contact us during that time.
At your first home visit, your community midwife will plan your care, which will include our visits or seeing us in postnatal clinic. We complete checks on mum, and we also, with your permission, perform important health checks on baby or babies. These include weighing baby, discussing feeding and any concerns you have. The screening is normally carried out at home between days 5 to 7 or in postnatal clinics. The blood spot test is to screen for those babies who may have any of 9 serious health conditions, including underactive thyroid and sickle cell disease. This involves taking a small blood sample from baby's heel that goes onto a sample card to be sent to a laboratory. Results are then telephoned or posted to you. The hearing screening helps to identify the possible 1 to 2 babies in every 1,000 that are born with hearing loss. It involves a small soft-tipped earpiece being placed in baby's ear, which plays a soft clicking sound. Most babies sleep through the screening. If babies do have an initial unclear response, we repeat the screening a few days later. Some babies do have a small amount of fluid in their ear after birth, and the screening can be affected by background noise or if baby is unsettled. Details of these can be found in your screening test for you and your baby leaflet. We can also see mums on additional days for support with feeding if needed. So let us know if you have any concerns and we will be happy to help.
All babies will cry, although some do this more than others. Crying is your baby telling you that they need something, such as a nappy change, a feed, winding, a cuddle, or to say that they're too warm or too cold. Sometimes your baby may cry and it's not easily comforted. Typically, this often happens in the evening when you're also at your most tired, so it can be very tricky to cope with. Here are a few tips to try and help. If you are breastfeeding, try letting your baby suckle on the breast. Some gentle background noise may help, or hold your baby close to you in a sling and gently move or sway. Try talking or singing gently to your baby, or rocking your baby gently in their pram. Try going for a walk or a drive. Sometimes babies sleep well in the car as they find the movement soothing. Find something for them to listen to or to look at, such as a mobile over their cot, a toy or the radio. Or try giving your baby a massage or a warm bath. If this is an ongoing problem for you, it may be advisable to keep a diary of when your baby cries excessively and consider changes to your routine that may help. Of course, if you feel that your baby is ill or the crying is accompanied by another symptom, such as a high temperature, you should seek medical attention. There may be occasions when excessive crying makes you feel tired and angry, and it becomes too stressful. This is actually quite common, and you should not feel ashamed of these feelings, as we are, after all, only human, but you should ask for help. See if someone else can look after your baby for you for a short period of time to give you a break. If not, put your baby in their pram or cot and ensure that they are safe, then close the door and move into another room to calm down for a period of time, such as 10 minutes, before going back to them. No matter how frustrated you become, you must never shake your baby, as this may result in brain damage from the violent movement of their head. We hope that this helps you to cope with your crying baby, and remember that you are not the only one experiencing it, and it is most definitely not any reflection on your parenting or how much your baby loves you.
We do hope that you've had a pleasant stay within the maternity unit at the Great Western Hospital. We always appreciate your feedback on not only how we're doing, but also how we can improve our services. So we ask that you please take the time to complete the Friends and Family survey, either using the form available on the ward today or the online version, which is available on the Trust website. Alternatively, please speak to a senior member of staff during your stay. If you have any concerns or queries about anything discussed in this video or anything else that has arisen during your pregnancy, contact details can be found either on the front of your handheld maternity notes or within the Going Home from Maternity Unit leaflet. So once again, all of the team would like to congratulate you and your family on the birth of your baby.